World AIDS Day is more than just a date on the global health calendar. Established in 1988 by the World Health Organization, it is a reminder of lives lost, progress made, and the urgent work that remains. This year's theme, Overcoming Disruption, Transforming the AIDS Response, highlights threats to prevention and care while calling for renewed solidarity and innovation. By the end of 2024, nearly 40.8 million people globally were living with HIV, including nearly 2 million in Nigeria, where gaps in testing and treatment make the fight against HIV as critical as ever.
In our campaign to contain HIV/AIDS, what it actually means as a practitioner is a reminder of the goals ahead in order to actually get this infection under control. We have set a date as a country, 2030, to eliminate HIV/AIDS as a public health problem. And we are looking forward to this, but we know that the task is ahead is very much given the time constraints we face.
What AIDS Day gives us a chance to reflect on how far we have come as physicians, as health workers, and also as a community in fighting against HIV/AIDS. And then it reminds us that every patient or every person living with HIV deserves love, deserves dignity, deserves access to treatment. And this day is quite significant because also you are reminded of those who have fallen or died as a result of this disease, and then we are able to reflect on our commitment to review some of the things that some of the laid down guidelines in treatment of HIV/AIDS. So
Healthcare workers warn that supply disruptions and funding gaps threaten access to antiretroviral therapy and HIV testing nationwide. Emerging challenges including insecurity and displacement are worsening the situation, with states like Benue experiencing a surge in prevalence, a development experts say could be exploited if not urgently addressed.
some key challenges faced by people living with HIV and AIDS stem from financial challenges. So there is poor finances, economic hardship, the fact that they are faced with stigma. Some of them don't have family support, community support, and so this can be very overwhelming. Yes.
Churches and elsewhere, mosques, we are seeing that the HIV/AIDS could be weaponized as a means to actually cause even greater havoc in society. If these girls who are being kidnapped from girls' schools are raped and assaulted, and you now have a rising incidence of HIV/AIDS, this is a very bad development going forward. That means we are going to be dealing with consequences of this disease. And those people who are involved in this act should be charged, not just for the violence, not just for committing the offenses they have done, but by actually assault with a deadly weapon. So this changes the entire human rights issues involved in the insurgency or in the instability with regard to women and girls.
Despite awareness campaigns, many young people still hesitate to know their HIV status, and affordability remains a barrier. Free test initiatives help, but gaps persist.
Even the meager amounts sometimes, which has to be charged by the laboratories, might pose some challenge to the youth. And how we overcome this is by organizing seasonal free testing, which actually works well with some of the youth, and we are able to provide them testing without actually it incurring any cost to them.
Even though more young people now are interested in knowing their status and all that, there's still a significant number of them who are afraid of getting to know their status. They don't want to know their status. Maybe some of them feel they are too young. Why should I check my status and all that? And so these are some of the things or the influences that we see as that are stopping young people from getting to know their status. And there's still enormous gap that needs to be filled. So more young people, especially in the rural areas and some other settlements, are encouraged to go and check their status.
Experts urge public awareness, government-supported testing and treatment, and protection for displaced persons, emphasizing that HIV is not a death sentence and timely care enables healthy lives.
HIV, is not a death sentence. It can be managed, and of course, prevention is better than cure. So people, let's put hands together and support those who are living with HIV, and then also encourage people to get screened and get tested.
In this era of insecurity, we have to remember and have in mind the internally displaced people and make sure there are no major outbreaks of HIV/AIDS associated with the insecurity across the country.
On this World AIDS Day, the call is urgent. Fund HIV services, protect access to care, expand testing, fight stigma, and support people living with HIV, not just with medicine, but with dignity, justice, and solidarity. Victoria Akonde, TV 360 News, Lagos.